Hi, my name is Shauna Johnson, and I am doing my presentation on rural versus urban areas. And I'm going to talk about substance abuse. What is the difference between rural and urban? The difference is this is a rural area. It is more country. It has more agriculture. It has more. The people there live more off the land. They have less resources. In urban areas, when you say urban and think of urban, you think of cities, towns, and the luxuries. What is substance abuse? Substance abuse is when individuals use a mood or behavior altering substance resulting in significant impairment or distress. Substance abuse can be alcohol, wine, and it can be drugs, medication. All those things are classified as substances. Rural versus urban substance abuse and admissions. In rural areas, rehab programs admissions often see high numbers into drug rehab programs. These individuals tend to come through criminal justice referrals, meaning through the court system. These referrals are made, the clients are made to go to court, made to go to rehab in order to seek treatment. These clients sought treatment through their experience troubles with the law enforcement and directly leads them to some kind of substance abuse. Individuals living in urban areas most likely enter these programs voluntarily due to family pressures. Factors that contribute to substance abuse in rural America are low education, meaning that the people there, they have low education. Some only have maybe the minimum of a high school diploma, or some didn't even get that far. Poverty, unemployment, high risk behavior, and isolation. Factors that contribute to substance abuse in rural America are availability and affordability. Rural versus urban differences in the types of substance abuse being used. Individuals in urban and rural areas are abusing the same substances. Rural treatment programs saw that most significant numbers of patients seeking treatment for their first time was because of alcohol abuse. Rural residents are also more likely to seek help for alcohol abuse than non-heroin or opiates, meaning that in rural areas they see a high number of alcohol abuse and less clients coming in for drug treatment. Why is underage drinking and binge drinking prevalent in rural communities versus urban communities? Rural has lower levels of parent disapproval. Urban parents are most likely outspoken about their disapproval of alcohol usage due to the consequences that they may face. In urban areas, there are more workers like DHS workers that parents are held to high different standards, meaning that they have to make sure their kids are not using drugs, and it's easier to be reported to DHS in those areas versus in rural areas where the number of DHS workers and access to DHS workers are low. Higher acceptance and peer alcoholism among most of the peers, and in urban areas they use it because they are afraid of friends judging or outcasting them due to the drug usage. Easier access to alcohol at family events in rural areas. When families do get together, most of the time they do have alcohol beverages, so that makes it easier for underage children to drink. Substance abuse within the rural communities can present many problems. It increases the crime and violence, vehicular accidents caused by drinking while intoxication, spreading infectious diseases, fetal alcohol syndrome. This is when mothers are pregnant and they use alcohol. Risky sexual behavior, homelessness, and unemployment. Challenges in rural communities versus urban. Rural behavioral health and detox services are not available in rural areas like they are in urban areas. Urban areas have more detox services that offer an extensive range of services for their patients and for their the different types of treatment, and they're more affordable, or they have access to ways to get grants and to get their treatment paid for. Urban patients who require treatment for substance abuse may only have to travel a few miles to go to the nearest inpatient treatment, versus in rural areas they may have to go hundreds of miles, or some even have to leave the state. Rural patients seeking substance abuse treatment may be more hesitant to do so because of privacy issues, where in urban areas patients are more willing to go and get treatment because 9 times out of 10 they want other people that's servicing them. How rural communities combat substance abuse are similar to urban areas. The things that's similar to them to the rural and the urban areas, they are all trying to combat these types of abuse through training of law enforcement, inviting guest speakers in, to speak to underage children. They're collaborating with churches, sororities, and clubs to help provide systems to individuals in recovery. They train volunteers to refer individuals that are at risk and develop a formal substance abuse prevention or treatment program for their community. How can rural and urban social workers help address substance abuse and connect to their parents in substance abuse treatment? Working with individual groups such as sororities, clubs, be involved in the community, know the struggles and the strengths of the community, act as a counselor to the clients, understand the behaviors and warning signs of individual using the substance, be able to link plans to resources, access and address the community needs, be knowledgeable of the laws about substance abuse, advocate for funding for individuals struggling with drug abuse. Thank you, and these are my references.